Empowering young people to track local climate and health risks is no longer a side project. It is one of the few practical strategies left to build awareness, resilience, and data that governments are failing to collect fast enough. Around the world, communities are already feeling the pressure of rising temperatures, erratic rainfall, and disease patterns that no longer match the seasons. But in too many places, especially rural and low-income regions, there are no local monitoring systems, no consistent reporting, and no voices connecting these changes to everyday health. This is where youth engagement becomes not just educational, but life-saving. When students learn to track their own climate and health environments, measuring heat, water quality, and disease trends, they become the first line of detection in a global system that urgently needs more eyes, ears, and critical minds. The potential for youth-led projects lies in their dual power. They generate data and inspire responsibility. Students who log local temperatures or water pH readings are doing more than a science project. They are contributing to a growing map of environmental stress that can reveal hidden risks. In regions where satellite coverage is too coarse or official reporting too slow, simple community data can alert officials to heat extremes or contamination before crises escalate. Yet this requires proper framing and caution. Without guidance, young people can easily become disillusioned or overwhelmed by what they discover. Climate education must therefore include emotional support, ethical data handling, and mentorship from both scientists and health professionals. The goal is not just to measure a warming world, but to cultivate resilience, empathy, and agency. Heat tracking is an accessible first step. Students can use basic thermometers or low-cost digital sensors to log daily maximum and nighttime temperatures around schools, homes, and workplaces. Patterns that show consistently elevated nighttime heat, the kind that prevents the body from recovering, can become the basis for community warnings. These youth networks could alert local clinics or radio stations when dangerous wet bulb conditions approach, providing a simple but powerful early warning system. Over time, such data could be integrated with local hospital or pharmacy records to reveal correlations between heat spikes and illness, something many health departments still lack the capacity to analyze. Water monitoring is equally crucial. Rising ocean and surface temperatures are changing microbial and chemical profiles in ways that directly threaten human health. Students can collect simple data on turbidity, salinity, or temperature from local rivers, ponds, and wells. When done under supervision, they can also test for basic indicators of contamination, such as E. coli or algal presence. These small projects, multiplied across regions, could expose the creeping deterioration of community water sources long before full outbreaks of diarrhea or skin disease occur. The warning here is that water systems are changing faster than most people realize. Toxins and pathogens thrive in warm, stagnant conditions, and without early detection, entire populations can be poisoned before symptoms become obvious. Disease surveillance is perhaps the most challenging but also the most urgent frontier. Youth can assist in observational projects, recording mosquito density, breeding sites, or community symptoms under safe, guided conditions. With climate shifts driving mosquitoes, ticks, and other vectors into new zones, student observers could help identify early incursions of dengue, chikungunya, or malaria. Yet this work carries risk. Poor handling of samples or untrained exposure to infected areas could endanger students. For this reason, partnerships with local health departments or NGOs are critical. Youth involvement must be structured, supervised, and centered on safety and data integrity. It should never replace professional epidemiology, but it can complement it, filling dangerous gaps in community-level awareness. The warning signs of failure are already visible. Heat deaths are rising faster than emergency systems can adapt, contaminated water kills more children each year than conflict, and new infectious diseases are appearing where health systems have no prior experience. Yet, despite this, many communities remain unaware of how closely their local environment and health are linked. Engaging youth is a way to rebuild that connection, to make climate change visible and personal. However, without institutional support, these projects risk becoming token gestures, photo opportunities for schools or NGOs, rather than sustained systems of observation and response. To be effective, student monitoring must feed into official climate health databases, inform real decisions, and receive recognition and feedback. Otherwise, young people will see their contributions vanish into silence, deepening cynicism instead of empowerment. Another danger lies in inequity. Wealthier schools can afford sensors and digital data platforms, while poorer communities may lack even the most basic equipment. This imbalance could mirror the very inequalities that make climate change so unjust, where those most at risk have the least capacity to measure or respond. To prevent this, youth climate health projects should prioritize inclusion, providing shared kits, open data tools, and free training accessible to all. Local governments, universities, and civil society must cooperate to ensure that every community can participate, not just those with resources or connections. Psychologically, this movement carries both hope and danger. Tracking environmental decline can empower, but it can also traumatize. Many young people already feel paralyzed by climate anxiety. If they're exposed to constant data showing heat rising and water deteriorating without tangible action or adult acknowledgement, despair may set in. Thus, mentorship and community engagement are as important as the measurements themselves. Each project should include discussions on coping with eco-stress, storytelling that connects data to shared problem-solving, and recognition that collective action, no matter how small, matters. The most serious warning, however, is systemic. Unless governments and institutions take the data collected by youth seriously, the entire exercise risks becoming symbolic while conditions worsen. Real integration is needed, student observations feeding into meteorological services, water authorities, and public health planning. Their findings could inform when to open cooling centers, when to issue boil water advisories, or when to intensify mosquito control. The world cannot afford to overlook any source of information when climate-driven health risks are escalating faster than models predict. Youth projects tracking local climate health risks are not just educational exercises. They are the early scaffolding of a future public health defense network. Each reading of temperature, each water sample, each mosquito count is a small act of vigilance in a world where neglect has become deadly. The next generation has inherited a planet on the edge of heat and hunger. Their role is not optional. They are the observers, the witnesses, and, ultimately, the ones who will have to live with the data they collect. But adults, scientists, and policymakers must match their commitment with real support and institutional response. Without that, these youth projects will document a tragedy instead of helping prevent it.